New Age Parenting, presented by Neelkant IVF Hospitals. We have the experience.
Hello and a very warm welcome to New Age Parenting, and as we had promised in the last episode, we'll be starting from the beginning. Beginning means that we go back to the time when the couple decides to start a family, when they want to invite another soul in their life and they want to enjoy and experience parenthood. What are the obstacles? What are the apprehensions a couple goes through? And in today's time, infertility is becoming a major problem. In this episode, we'll be talking about majorly this issue. In Soul Searching today, we have the privilege to have a well-known fertility expert, Dr. Bindu Garg, who is associated with Neelkant IVF Hospital. A very warm welcome, ma'am.
Thank you.
Two people want to think about calling another being in their life. A lot of questions are there in today's generation, the youngsters especially. What would be the right age for a couple to go for a child?
See, there is not exactly a right age, but yes, earlier the better. But the normally fertility, what the researchers tell, that the fertility decreases after 20 years, but 20 years is too young. And of course, after 30 years, the patient, the couple, they normally have a problem in conceiving. So the right age is somewhere between 20 to 25, but exactly in these times today when everybody is working, but yes, they should plan a family around 23, 24, which is the maximum, not maximum, but the right age when the fertility is not that less and there is an easy conception with the assisted the methods.
Yeah.
So I would advise that when they get married around 22, 23, so that's the age when they should plan also.
What should be the outer limit also? Because that's again, a lot of things are being said and there are a lot of apprehensions today. Women have, men also have.
There is no exactly outer limit, but earlier the better, because what happens is that when you are initially in the initial years, you're not very apprehensive, so you take it very lightly. And once the age increases, then you become very more apprehensive, and you go to the doctor and you change so many treatments, which is more like an over enthusiastic treatments, and secondly then you don't have patience, you get into emotional stresses. So exactly there is no upper limit, but yes, the earlier the better.
Dr. Sabi, we'll talk about the infertility aspect. In today's times, you know, if we look back, like if we go back 15 years ago, 20 years ago, it wasn't that prevalent. But today, if we look at it, there is a major problem couples are facing, and young couple. What has happened? What is the reason?
The main reason is the lifestyle changes. Late marriage, and once after the marriage also they don't want to plan. The career is more important, and the lifestyle changes, like in the sense that obesity, more of the food changes, stress, main is the stress. The working stress right from morning. If you take the history of these multinationals, working in the multinationals or even in the normal, not even in multinationals, any working women, they get up early morning, the stress of the work, then coming home, stress of the home management also. So at the end of the day, half the times they are so tired. So these changes in the life have also increased the chances of infertility, but mainly stress.
Stress only
dietary
in the women?
Habits,
only in women or
no,
both?
Men,
Both. Okay.
Both. More of smoking, more of drinking, more of social parties. So all these have added to the increased chances of the infertility.
Okay, what really is the basic reason? What really happens when we say that there is a case of infertility? What really obstructs?
See, suppose after marriage, if a couple is not able to have a pregnancy within an year, so we tell them that now they should go to a doctor. Now, to what extent they should be treated? It is not that they are coming to you, so similar at the outright you start having all those tests. Basic. We see the age, we see in general the history gives us an idea that what may be the reason, so you investigate accordingly. But the main test that as a doctor anybody undergoes after the guidance only is the sperm analysis. That yes, we make sure that the sperm analysis is not less. Once that is okay, then the basic test is just an ultrasound findings and the basic hormone test. If they are normal, then we advise them to have more of patience and wait for a normal pregnancy. But after 1 year, if they are not able to have a pregnancy without using any contraception, we advise a person to consult a doctor. The family doctor can advise them, but if she feels that the investigations are showing any problem which is to be managed by the infertility expert, then that they are the best ones that to guide. The family doctor can guide them to what extent they should be treated, and if there is any investigation is showing any problem, then of course the role of infertility specialists come in.
Yeah, and in fact at this juncture I also would like to ask you is the emotional part of both the parents, emotional state of mother and the father.
Everything comes out from here. So if you're stressed, so there are hormonal changes, the quality of the egg is less, and secondly the emotional stress makes a role in the quality of eggs, plus there are so many other scientific reasons also where we feel that the fertilization is also less, the implantation is also less, and secondly when you are not able to conceive, then in India, especially in our social culture, the people make you feel emotionally more distressed, which adds on to the problems of infertility. So emotionally, but it's very easy to say that yes, relax, but practically speaking,
it's not that
part,
easy.
It's not that easy, and practically it's the people in our social environment that make you feel more like an infertile couple.
It's not happening only in the urban area. Even if we look at the rural couples, they are also facing it a lot. You know, what is your experience?
No, my experience in the rural areas, the things have not increased so much. But the only thing why we are having more of rural patients is because there's more of an awareness. Previously, there were myths that if you're going to a doctor, there is especially some very grave problem, and then they were socially outcast, that she's having an infertility problem. But now that myth has gone because people know that there are treatments. And the main myth about this treatment was that the sperms and eggs are not theirs. So that the baby, the acceptance of that baby born after the treatment was not so much, which is now not, because of the awareness through television, through media, through magazines, through education.
Very interesting thing you said, and very important, I think, is that the sperm and the egg is not theirs. The acceptance of the child is actually.
Acceptance of this. So they were more scared of going to a doctor and telling to a person that we are having a treatment. I still, it's many people, if they conceive in my hospital, then they don't come to me for the deliveries, because again that myth that if they deliver here, then it's an IVF child.
Oh.
Even if they conceive with the medicines only, I asked them what happened. They said my mother-in-law is not letting me come to your hospital for the delivery because they feel that the villages will feel it's an IVF child. Still it's there, but the rates have decreased. Then we tell them no. More of awareness, of course, is increasing, but still it will take some more years.
Wonderful. We would like to know more about what is IVF, but that will be in the third segment. So in fact, at this juncture, we'll take a short break. We'll be back soon. You can call us at our toll-free number 1800-102-6706, or you can mail us at ivf@neelkanthospital.com. You can visit our website www.neelkanthospital.com. Other than the Gurgaon branch, we have branches in Agra, Lucknow and Welcome back to New Age Parenting, and today we are talking about what are the reasons for infertility, and we have the privilege to have Dr. Bindu Garg, who is an infertility expert, and we in this segment, that is Mythbusters, we are going to talk about myths connected to infertility and how to bust it. You talked about few myths, you know, that the sperm and the egg is not theirs, and that is why the baby is not theirs.
Baby is not theirs.
And how do you actually burst that myth?
No, the main is the counseling. Whenever any couple is coming to us, my counselor, always we give them more than sometimes half an hour just to explain them what exactly the infertility treatment is and what is their customized treatment for them. If we feel that the IVF is the treatment for them, we always counsel that the eggs are yours, the sperms are yours, and the baby is yours only. But still, again, as I told you, that acceptance of the IVF child is still not that much in India. And if they don't resemble the parents, then they feel it's not theirs.
No, it's the parents who think this
Not
way?
the parents, never not the parents, not the family themselves, but it's more of the relatives. So we always tell them that it is for you to understand that it is not something from outside. We take the eggs or the sperms from outside only if you don't have your own eggs or the sperms are missing. The azoospermia cases, but otherwise, and they all agree. If you counsel them, my personal experience is that they all agree to this treatment. Another main myth is that it is, since the name test tube baby, which in the layman is still, they know it's a test tube baby. So what they feel is that this baby is somehow all 9 months it is in the machine. So they say there is a machine. Many people tell us, show us the machine, whether the baby grows.
Yeah, that's what.
Exactly.
You know, because they feel that the child actually grows in that test tube, the big glass.
Yes. So when we tell them that we'll transfer the embryo on day 3 and day 5, people say that transfer them a bit later. So they say that grow more into a machine. Then we have to tell them it's not the machine, it's the lady herself who is going to bring up the baby all through 9 months. It is not in the machine. It is just the name, which is a myth again, test tube baby. It is because the fertilization happens in the test tube outside the body. So that is why it is called as a test tube baby. It's a lab tube where it is fertilized. So it's basically a name that reflects. This is another myth. But the main myth still is that it's a very expensive process. It's very that you have to go every day and you have to rest for all those 9 months in bed. So many working women, they don't come for the treatment, that they can't rest. They can't leave the jobs. So we tell them, no, it's not 9 months rest, it's once they have conceived. It is just like any other baby, rest for 15-20 days, but if they have a complication, only then they have to rest.
What kind of infertility is there in men and women both?
In men, with changing lifestyle, as I told you, previously we used to have less of men problem, but now we have seen more of smoking, more of alcohol, more of stress, more of environmental changes, that the sperm count is less. And even they say that even these mobile, sometimes they cause all these rays. So this today fast moving life, that sperms are definitely decreasing. So we have more of male. 40% they say that it's a male cause, where the sperms are less. Either the number is less or the motility is less. And even they have many cases that unexplained, that previously they were normal and now when they go to a doctor, there are no sperms. So the male infertility is increasing. In the females, there are 3 main causes. The main is the faulty eggs, faulty eggs. That the quality of the eggs is very bad. So the condition is related to the ovaries. Then there are specific tests, or either the tubes can be blocked. So these are, but again there is a segment where the both have a problem. And 15% I told you where you cannot know the reason. People are accepting what is the problem. So the treatment is very much now streamlined and very much to the point. It's not that we just grope around that, let us try this, let us try this. No, this is not. If the male problem, they accept it. And I have seen there's so much of willpower. We tell them no smoking, no alcohol, and that's what people accept also.
Yes, you know, parenting is such a wonderful experience. To experience, we are ready to change. Dr. Garg,
but the only thing is, I just want to add one thing here, that if the sperms are nil, it is such a good thing to listen to the people that we don't want to tell, and the female doesn't tell. Sometimes I tell when they are. See, there are families where it's still taken as that everything, if they're not able to conceive, it's the female cause. Despite the mother-in-law knowing also that the cause is with the sperms, but still the female accepts it. I have seen most of the women, they take it in a very positive, that yes, there's a treatment for that also. So the thoughts and what was 1 year before or 2 years before, it's absolutely changed.
It has changed now in these 2 years.
Acceptance of every cause, and the treatment is 100%.
That's very beautiful, very positive aspect. And I think because of the new age kids who have to come, the parents are becoming more open and allowing actually the families to break the myths and move on.
But I feel that the role of the doctor and the role of the support system has to be very good to counsel.
Yes.
Which still lacks in India, because normally the clinics are just run by by the doctors themselves. So I personally feel that if you are dealing with the infertility, you should have a very sound support system to counsel them and to guide them to get over this emotional part, to get over the exactly counseling should be very perfect.
That's very important.
Then the acceptance is even better.
Yes, you know, the right kind of education has to be there.
Right.
We've understood there are myths, and we've also understood there are answers to it. So stay tuned, because we will be talking about these conflicts and how they have to be resolved in mapping the conflicts. In mapping the conflict today, again we have Dr. Bindu Garg, and we'll try to find out what are the different procedures. Dr. Garg, we have understood now that there are solutions to each and every problem. So you've said there are 3 problems with women and 1 problem which we could find out with the male. So what are the different procedures which are available?
See, the treatment depends upon many factors. The foremost is the age. That if the age is 35, of course we can't play with. So we have to be more active. Second is the cause. There are few causes which are relative, and there are few causes which are absolute causes. Suppose the tubes are blocked in the females. So that's immaterial. How old is she? If she's 20, then we have to be more active. If she's 40, obviously we have to be active. Duration of infertility. Suppose a couple is married only for 1 and 1.5 years, but the age is 22. So we are not very enthusiastic in going to the more aggressive treatments. So everything depends upon that what suits the couple. The treatment is not just IVF or not just being operative. First we try to get them pregnant in a natural way with medical assistance.
And what is the role of these medicines?
Medicines is that in the males they increase the sperm count, they increase the motility. In the females they make good quality eggs. We help them with rupture, the release of the eggs, and we help them with implantations, that once the egg is released and the embryo has formed, that the uterus is receptive and the implants it. So there are medicines for everything, but if you feel that the things are not working, then we are more active. So suppose if the tubes are blocked and the female is young, then we go for operative procedures. We try to open the tubes. There is a procedure called as laparoscopy. Laparoscopy is it's not a surgery, but yes, it's a minor form of a surgery where we admit the patient, daycare, and we just see the tubes. If they can be opened, then we open the tubes. There is another process which is a very simple process and everybody is now aware of, called as intrauterine inseminations. Suppose the males are having less sperm count, what we do is we wash the sperms and we inseminate in the uterus. The success is again 20% more than the natural methods. So we just call the female, give her the medicines. When the egg releases, then we take the husband's sperms, wash in and inseminate. And this is called as intrauterine inseminations. Of course, if the things are not working, then the ultimate is IVF. So basically it is not just the IVF. For every couple we try to make them pregnant in a natural way first, then more of assisted techniques, and if everything is not working, then of course
IVF is the last, or
if we can't say that IVF is the last, but if the tubes are blocked, as I told you, then IVF is the first.
Okay.
If the tubes cannot be opened, suppose they are very bad, dilated, tubercular, then there is no point doing a surgery also.
Your hospital, Neelkanth IVF and Fertility Hospital, has been doing a lot of awareness programs also. Not only the work, but of course creating awareness, positive awareness about this. And now you have centers in different states also. What is the response in different states?
Very good. Every day we get almost 50 to 100 calls, which we feel are increasing every day. So they basically talk to our counselors that this is a problem, how to go about. Not many people attend to the hospital, but on telephones only. So we tell them that yes, we devote a lot of time on these counseling.
Yeah, how much
even on telephones, even on telephones, we are never, my counselor never feels that it's almost 2 minutes or 3 minutes. We counsel them till they accept and till they know that what the treatment is. So basically by these telephonic calls also, they become aware of the treatment. Look, so suppose somebody is, we get so many calls from Patna, Bihar. Those people, they take some time to understand, but we make them understand that this is the treatment and you can get it done in Patna also. For this you don't have to come to the bigger cities. For IVF also now, everywhere these processes are there, but the awareness creating that you can go to a local doctor and get this treatment done is also helping them.
what is the success rate, and what is expected from the family and from the couple?
Yes,
You know,
yes,
like,
that's very important.
yes.
They should accept it that this is not 100%. The expectations sometimes are so much that if they don't conceive, then they go into so much of emotional depression, distress. They don't go to the office, they don't come up to the houses. That's what we counsel them, that yes, we are doing the treatment. Success is anywhere from 20 to 50%, but depends again on the cause. Suppose there is a, like you asked, the sperms are absent, and if you have a good sperm, obviously the success will be more. So it depends upon basically what is the reason, the cause in the female, cause in the male. But these days, with lot of new inventions in the equipment, the medias, the techniques, the injections, the success has increased tremendously.
You know, time period.
Time is again another myth, that we have to go to the doctor every day, get the scans every day, get an injection every day. No, it just takes. We start the process from day 21st of one cycle till day 20th of the next.
Okay,
so basically,
1 month.
Yes, 1 month, 56 days.
Yeah, and that actually shows whether it is.
That shows, and that also you don't have to go to the doctor every day. Now we teach the people, if they're educated people, we teach them how to take the injections. In the rural villages also, we pack the injections for them, and it's very surprising now. They are very accepting, and they know how to take the injection. We tell them, keep it in the coolant pack, take it out of the fridge, and they just comply to it.
Yeah.
We have seen awareness is so much, and the dedication, the very fact that you have to become a mother,
parent,
and
yes.
and that you have to have a success, so that they follow everything that we tell them.
Yeah.
So it is not that tiring treatment.
Yes, very true, and it has been really great to have you, because you're bringing so much happiness to so many couples. What are the emotional aspects of it, and how actually you feel? We'll be talking about these things in the coming episodes, but thank you so much that you've decided and to take this platform and talk about this whole, not only this procedure, but of course the whole emotion attached with
I want
becoming
to add
a parent.
one thing, that have faith in God and your destiny. If you have that, then of course you get a success.
Yes.
So basically it is just that don't lose faith in your destiny, that no, I mean, with good assistance, the success is very
Yes, definitely. There are options available. And of course, they reach at the right time, at the right place.
Yes, that's more
Thank you
important.
so much, ma'am. Thanks a lot. In fact, it's beautiful to understand that it is possible, and we are in these times when we have been talking on this platform about new age kids, that these kids are raring to come. You just have to create a space, and even if there is a physical, blockage, and there are myths attached to it, there are options now available technically, emotionally, and the way we are seeing it. Next 3 episodes we are going to dedicate completely. We've asked Dr. Garg to be a part of it. So if you have any query, please feel free, give us a call, or you can mail us your questions. You can call us at our toll-free number 1800-102-6706, or you can mail us at ivf@neelkanthospital.com. You can visit our website www.neelkanthospital.com. Other than the Gurgaon branch, we have branches in Agra, Lucknow and Aligarh. So till the time we meet again, enjoy parenting.